that the federal that no, that's great, thank you. The federal budget is the vehicle that's being used to cut Medicaid. And the reason they are cutting Medicaid, and in fact, every cut being made, um, the reason for those cuts is to hand a nearly $5 trillion tax cut to billionaires and wealthy corporations. That's the point. That's what they're doing. That's the reason for them to exist in this time and to have a budget at all. It's to get those tax cuts for billionaires put in place. They're also spending money on, border enforcement. Those are their words, and a lot of money on the army. I think Trump's budget asked for $1 trillion block for the military or something like that. But really, that's just now getting into the weeds, into the details when they can derail the conversation from the point, which is they want to pass $5 trillion of tax cuts for billionaires. And how do you do that without adding it to the debt? You certainly could add it to the debt. Um, there are people, myself included, who make the point that the debt is meaningless, that the federal debt really doesn't mean anything right now. So you could add $5 trillion to the debt, but they've spent decades telling us that the debt is going to kill us all in our sleep, and so we can't have a national debt. And so they really can't do that, although they did with the original Trump tax cuts. They did add trillions to the debt, and they could do that again, but sitting right in front of them is the opportunity to cut Medicaid. And you have to understand that foundational to the conservative ideology is that the federal government should not be involved in healthcare. That's part of their, like I said, it's foundational to their ideology. You'll also remember that in 2010, the Affordable Care Act was put into place, and Medicaid, which is a federal healthcare program, Medicaid was expanded. And so that was absolutely crushing to conservatives. I have my air quotes up here, to conservatives. That was devastating to them, that this program that they don't even want to exist had been expanded. And then you remember the court cases ensued, and they resulted in not having every state expand Medicaid, but I think 39 or 40 states only have expanded Medicaid. And in the states that haven't, there are people falling into debt, getting sick, and dying because Medicaid was not expanded. So this is not a consequence-free decision to not allow people to have access to medical care. When you don't allow people access to medical care, they they go into debt, they get sick, and they die. Those things happen. It's unavoidable. It's well documented. It is a fact. So let me share my screen. This is where we are. This is where we're living right now. That's kind of what I um, kind of outlined with that background information. Sorry, I just got to grab the right screen. I have a tab open to look at Grover Norquist. Apparently, I don't have enough pain in my life. I need to also look at Grover Norquist. Does anybody remember him at all? He was very popular for a long time. Any hands up? You remember Grover Norquist? He
Mm.
was the driving force for a long time, famous for saying, "I want to make government shrink government to the size where it can be drowned in a bathtub." Is this ringing any bells? He
Yeah.
was a very popular, very frontward facing face of this movement. And he's kind of faded into the background, but he's still, back there pulling strings. Anyway, that's Grover Norquist. So this is Medicaid. Medicaid is the most powerful public health intervention we've ever had. It is more powerful than Medicare. It covers things Medicare doesn't cover. It covers more people than Medicare. It is a truly miraculous program. We are lucky to have it. And it is, ever since the first day it's been implemented, has been under attack. Let's look at who's covered by Medicaid. It's got 3 million people around the state. 1.2 million of those are children. About a million are seniors and people with disabilities. So you're putting two big populations in there, seniors and people with disabilities and pregnant individuals. This would be considered traditional Medicaid, low income people with these who also fall into these categories. So it isn't just enough to be low income. If you're a low income 28-year-old man, you don't get Medicaid. If you're a low income pregnant woman, you get traditional Medicaid. Okay. Then, because of the gap we had that was forming between people who earned just a little bit too much for traditional Medicaid and the newly going to be implemented Affordable Care Act, which said, hey, 28-year-old guy, you don't have insurance through your job, you don't qualify for Medicaid, you're a low income person, and you need to see a doctor. That's, we believe that. Then how about this? You can use the Affordable Care Act. Uh, Buy into some insurance. It'll be like work. You'll buy into this plan. It will cover you. Blah blah blah. We all know the Affordable Care Act. But they made the threshold to buying into the Affordable Care Act high. It's an income. There's an income threshold to being able to buy into the Affordable Care Act. And if you don't meet that threshold, then you, according to the Affordable Care Act, would then qualify for Medicaid, not traditional Medicaid, because we're going to take that 28-year-old man who isn't sick. Um, and obviously not pregnant. So we're going, or disabled. So he has nowhere to go. So he doesn't qualify for traditional. He doesn't make enough to buy into the Affordable Care Act. So what are we going to do? We're going to institute Medicaid expansion. And this is why it's called Medicaid expansion. We expanded Medicaid to close that gap, and it was wonderful, and it has been saving lives since the day it's been put into place. And like I said earlier, in the states that don't have it, people are dying unnecessarily. That's a fact. So we have 750, let's say, because I've recently seen 751, 747, hovers around there, 750,000 people in Pennsylvania rely on Medicaid expansion to get their health insurance. These are seasonal workers. These are workers at Home Depot who don't make enough to buy the Home Depot insurance, so they opt into Medicaid expansion. These are people who oftentimes are disabled. Maybe they're not, quote, officially disabled, but they are disabled in some capacity. They can only work part-time. And so they need insurance. Where do they go? They get it from Medicaid expansion. These are your 61-year-olds, 62-year-olds who've been laid off and they've lost their insurance, but they're too young to qualify for Medicare. And so what do? Maybe they get a job as a Walmart greeter. That's the classic. It's become a cliche. Maybe they get a part-time job at a garden center. Maybe they, who knows, they get work. It's not the accounting job they had, but it is work. Or maybe they can't find any work at all. And these people are scooped up by Medicaid expansion. So it's a really important program. We need to make sure to keep it. And it is under dire attack right now. Let's just look at the spend for a minute. This is important. So you see 1.2 million children, and it only counts for, I think it is, that's say 8% of the spend. So we cover 1.2 million kids. It's 42% of the enrollment, but it's hardly any of the spend. It's hardly any of the dollars that go out. Look down at the Medicaid expansion column or row. You've got 750,000 people covered. That's 25% of enrollment, and it's only 11% of the spend. Really low numbers here. Where most of the money goes, and this is important to remember, and we're not blaming anyone, we're just stating a fact at this point. Where most of the money needs to be spent is on seniors, people with disabilities, and it says here pregnant people, but even, pregnant, it's expensive to have a child, yes, but really it's people with disabilities and it's seniors. This is where most of the spend comes from. 80% of the spend comes from that group, which is fine. Nobody is to blame for this. If it costs a lot to make people healthy because they're able to see a doctor or go to a hospital, that's the fault of the American healthcare system, which charges way too much for its services. So that's a whole other discussion. But people using healthcare are not to be blamed for the cost of that healthcare. It's really important to remember. So this is also important. So we've got who's covered by Medicaid and how important Medicaid is. This is foundational on our side, right? This is really, and really, it's what most Americans believe. When you really do some deep dive polling, this is what most Americans believe, that we are all connected. They do get that. It's a little more fragilely held on when you get further to the right of the spectrum than it is to the left of the spectrum. But basically, like I said, if you do a deep dive poll, you will get to where people say, well, sure, yes, we don't want people thrown off their health insurance. And if that health insurance is Medicaid, we don't want it taken away from them. They do realize that there's a responsibility in a society. Like I said, a little more fragile as you move to the right, a little more robust as you move to the left. But this is important, and it's certainly important when you're talking about insurance, because when you're talking about insurance, we are all connected, not in the feel good way, but in the way where you've got to have enough people in your insurance pool to make insurance worth having, and I mean, as the insurance company, worth providing. And so you get it from this very, fiscal side of it as well. This is what I like the best, though. So those images were nice, but I like this image the best. First of all, it accounts for a lot of different skin tones, which appeals to me as somebody who understands that we are not all the same color. Um, it also sort of kind of touches on age, although I really don't see that represented as well as other types of differences that we have. So you've got your skin tone, like I said, you've got different genders in there. You've got people who are differently abled. You've got the cane, you've got the wheelchair. And the other thing I really like about this picture is if you pick any one of these people and take them out of the equation, or the picture, this is going to collapse. So, I mean, if you could do this to yourself, you just pick somebody, anybody, and take them out, the whole thing is going to start to collapse. That's how Medicaid works. That's how any society works. You can't take a group out and expect the rest of the system to keep going. So keep this in mind as we talk. So what's happening in Congress right now? So they have to pass a federal budget. The budget in the at the federal level runs from October to October. So they have to get a budget done by September 30th. And you might be thinking right now, no, they don't. There have been plenty of years where they don't get a budget done and they do things called continuing resolutions. Yes, you would be right about that. You can do a continuing resolution. You don't have to have a budget. You can just say the budget from last year is fine, and they can even make little tweaks go to a continuing resolution as they want. Really, ultimately, Congress can do whatever it wants. So you could do that. But remember, they don't want to do that. And when I say they, I unfortunately mean Republicans. I have to use party names here because it is again a fact. It is the Republicans in Congress who are driving this. They have both chambers of Congress, and so they are making these decisions. And they've been clear that their priority is to pass what they refer to as the president's economic agenda, which is kind of a dishonest way of saying we want to pass $5 trillion in tax cuts for billionaires, because that is the linchpin, that is the key point of this quote economic agenda. They cannot do this with a continuing resolution. They can't do it. So they have to pass a budget. How are they doing the budget? I don't know how much we want to go through what reconciliation is. Maybe I'll just say, and then we can stop here if anyone has any questions, but let me just say they're using a process called reconciliation. Reconciliation is neither good nor bad. If you like what's getting passed through reconciliation, it's a great process. If you don't like what's getting passed through reconciliation, it's a horrible idea. But the fact is it's just a way to move a bill in Congress. And what it does is grease the skids. So it takes away the filibuster options. Senate can't filibuster anything that moves through reconciliation, and it takes other regular order rules out, so things move quicker. So, but to pay for that, not pay with money, but the trade-off for being able to get your bill to move so fast is that it has to only deal with certain things. And those things has to be budget, and it has to be budget related, it has to be taxing and spending. It can't be modifying a program, naming a post office. It has to be, it's narrow. The focus of it has to be narrow. The person who decides in the Senate if the bill meets those narrower guidelines is called the parliamentarian. The parliamentarian has traditionally been the person who looks at the bill that you want to use reconciliation to pass and says, "Oh, nope, this won't work. You got to take this piece out." Or you've got to take this other piece out. One, two, five, maybe the whole bill is poison and it's not going to move. That's rare. But the parliamentarian usually is the person that gets to say, this has to come out of your bill. This does not belong in a bill that has to focus on the things that reconciliation focuses on. The Republicans, again, my apologies, but this is a fact. The Republicans have already laid the groundwork for not paying attention to what the parliamentarian says. So if you're talking about this to anybody and they say, well, when it comes to the parliamentarian, they're really gonna, rein this in. No, they will not. They have already said that they believe that somehow Lindsey Graham should have the authority to make decisions. Please don't ask me to get into that. All I can tell you is they've already laid the groundwork for circumventing the parliamentarian. And you might be thinking, well, how do you do that? You can't just like not do things that are laid out. Well, the parliamentarian and following what they say is a norm. And so, of course, norms can be violated, and there's no consequence. What are you going to do? If you violate a norm, it's not breaking a law. And we know that this administration, I'm not talking about the Republican Party now, but we know that this administration has no trouble breaking laws. They don't worry about that. Certainly, violating a norm is not something that would rise to their get appear on their radar as something they shouldn't do. So the parliamentarian is sort of out of the picture now. Does anybody need to hear more about what reconciliation is? Anybody interested in that? Questions? Okay, so the short answer is it's just a process in Congress that allows bills to move faster. Okay. A few weeks ago, Congress cleared one of the hurdles of reconciliation that allows them to now get down to writing a budget. I'm not going to get into the hurdle that they cleared because it's just in the weeds. And if anybody wants to know, feel free to ask it. I'll explain it all you want. But it's an administrative hurdle. They got it done, and now they have to get down to the nitty gritty of writing the budget. This is important because before they did this, they had simply guidelines of the budget. We want the Energy and Commerce Committee to find $880 billion, almost $1 trillion worth of cuts. That's what we want them to do. We want other committees to find this number of cuts. That's called a budget resolution. And so the resolution was out there with guidelines for committees. And we were over here saying, hey, you're going to cut Medicaid. And they were over there saying, oh, no, we're offended that you would suggest that we want to cut Medicaid. You're not allowed to say that. You're defaming us. If you look at this resolution, you will see not one mention of a cut to Medicaid. And of course, that was all a lie. There was certainly no mention of a cut to Medicaid, but they did say that you need to find almost $1 trillion in cuts to the Energy and Commerce Committee, which covers Medicaid. There's no way Energy and Commerce can cut that much without touching Medicaid. So for a while, though, for many, many weeks, months even, they were able to skate by on that obfuscation. They sort of hid behind that wordplay. Now, though, they have to get down to writing the budget, and they're doing it. They're doing that. And when you get down to actually writing the budget, and Energy and Commerce has to actually disclose where those cuts are going to be, we're going to see what they're going to do to Medicaid, which we knew all along. And so we have, we moved through a period where first they were lying. They were just straight out lying. The president said he doesn't want to cut Medicaid. We have no intention of cutting Medicaid. That was just a straight out lie. Now they're into the part of it where they have to make the lie, make what they're going to do look good. So think of it as a child striking their sibling, right? So you say, I saw you hit your sibling. And the child says, no, I didn't do it. And you say, well, I saw you hit your sibling. It happened. And then the child needs to pivot immediately to, well, yes, but let me explain why she deserved it, or he or she deserved that. Why I had to hit my sibling. This is the period we're in now, where they're explaining to you why they have to do the horrible thing. We told you we weren't going to cut Medicaid. Now we're in the point of our lie where we've been caught in our lie, and now we have to explain to you why we need to cut Medicaid. And this is the kind of cuts they're considering. Um, we don't know because we haven't seen it yet. But this is what we've been hearing, what they've been talking about. If they were to make these cuts, these per capita caps, or we haven't heard about block grants, but block granting is not off the table. And I can pause on this slide to explain or answer any questions about per capita caps and block grants. Per capita caps are getting more conversation now. They definitely want to reduce funding for Medicaid expansion. They want to drive down the amount of money that the states get from the federal government for Medicaid expansion. And we can get into those details too, if you want. They want to limit how Pennsylvania pays for its Medicaid. So they're going to put rules that say that Pennsylvania cannot use all the avenues it's been using to pay for Medicaid. It's going to take some of those away from it. And it's going to just make Medicaid funding less certain overall. We expect that if these things happened, to get between a 1 billion and a $4 billion in yearly cuts, yearly burden to Pennsylvania budgeting. Um, uh, so a yearly burden to Pennsylvania budgeting between $1 and $4 billion. If they just ended Medicaid expansion, we think it would be over a $1 billion hole every single year in the Pennsylvania budget. And as you know, states cannot print money, so there's no way for Pennsylvania to magically come up with this money. It would have to either reduce services, raise taxes, and that's it. That's all Pennsylvania can do. Pennsylvania cannot print money like the federal government can. Pennsylvania cannot run at a deficit like the federal government can. And so it needs to, like I just said, cut services or raise taxes. That's the only thing it can do. Um, and that's the other side is where it says roughly 250,000 people would lose coverage wrongly. That's talking about adding Medicaid work requirements, which we haven't even talked about, but that's getting a lot of attention on Congress from Congress too, adding work requirements, which we can circle back to if anyone has any questions about those. But they are definitely not a good thing. There's nothing good about work requirements. They do not help people get to work. They simply rely on administrative errors to kick people off of Medicaid. Remember, it's foundational. They don't believe Medicaid should exist in the first place. Medicaid work requirements are a way to force people to go through more red tape and more paperwork, and then inevitably there will be administrative errors, and people going through this paperwork will be kicked off their services. Uh, it could be for 1 month, 2 months. Sometimes it could be forever. You know, they don't care as long as people do lose access to Medicaid, fewer people using Medicaid. So let me stop here. Are there any terms here anyone wants to discuss? Per capita caps? Um, I don't want to.
Robin, I have a quick
Sure.
question. Um, I had read somewhere that if that they cannot, Pennsylvania will not be able to cut any services to children, that will be, it's like sink or swim, sink or
Why would that be the case?
well, I don't know what this article was saying, but it was something about how constitutionally or the federal law says children can't be affected. So the majority of people who will be affected by changes in eligibility or cuts to programs would end up being senior
Mhm.
citizens or older nursing home individuals and those with um, disabilities, whether they be physical or mental.
Mhm.
But you're saying no, there's
No, nothing. I don't, I'm not familiar with that article, so I'm going to leave room for me to be wrong. But I really have never heard that. Children are not protected by this at all, in any way that I'm aware of. In fact, I can tell you about it very quickly about a program called PH95 in Pennsylvania. PH95 is a program where a family, the Smiths, do not financially qualify for Medicaid. They make money, right? They have jobs, whatever, and they make too much to qualify for Medicaid. But they have a child who is medically fragile. They use the disabilities guidelines from the Social Security Administration to figure it out, but they are not technically disabled, but they are medically fragile. And for the purposes of PH95, they then will be allowed to use Medicaid. So you could have three children. One of them is, for instance, on the autism spectrum, or one of them is even diabetic counts, or you can have a mildly involved medically fragile all the way to tube fed, non-mobile 24/7 nursing care required, all the way to that end of the spectrum. And that child would qualify for Medicaid, whereas no one else in the family would. The other two children and the parents would not. Those children are 100% at risk of losing their services, or their parents being forced to contribute more to their care, paying premiums. We don't know what it would look like. Maybe it looks like they stop the enrollment of PH95. They say, look, Pennsylvania can handle this, but we cannot handle any more PH95 people. Or, like I said, we add premiums and then we wait list people on PH95. So we want to bring in more children to PH95, but we can't afford it. So we're going to have a limit of only X number of people can get PH95 for a year, and we run out of places by April. And so for the rest of the year, until children die, I suppose, or age out, you will not be able to get into this PH95 program. That's definitely something that will harm children. and it's 100% definitely on the horizon, within the realm of imagining if they were to put this burden on Pennsylvania budget wise. Is
Robin,
that
if I jump in here as well?
sure?
I wanted to add just because I think the issue of children is a really poignant one. I read in the York Dispatch recently that 40% of children in Pennsylvania statewide are eligible for Medicaid.
Mhm.
And so these definitely are folks who would be on the chopping block. I think they said the people most at risk are pregnant people, children, people with disabilities, and low income earners. And a lot of the things we're looking at, I think, like you were talking about, is full closure of hospitals, of services. And so, even if it's not directly targeting children, children will be affected, especially when we're looking at something that's based in our Constitution. Our Constitution does try to protect people of Pennsylvania, but I mean, even if you look at education, it took decades of really, really hard fighting to get our Supreme Court of Pennsylvania to say, look, the way we're funding education is unconstitutional. And now they have 7 years to do something about it. So
Wow.
even when our Constitution does protect us, it takes a long time for that to play out in a lot of work. So I think it's definitely a scary time, but it's definitely also good to look at, priorities in Pennsylvania.
Yes, definitely. And I'm going to ask Clara to send me that article because I'd like to read it. But I truly believe, like you were saying, Arlie, when it was Arlie, yes, who
Yes,
was
that was me.
yes,
Sorry.
Arlie was just speaking. When the rubber hits the road, as Arlie was suggesting, if there's money, it gets spent. And if there's no money, it doesn't get spent, and then people get hurt. And that's just the facts. And it takes like also you said years and years and years. It could take decades to sort this out. And meanwhile, people are going into debt, getting sick, and dying. That's what happens when we don't have access to care. So this got some attention. See these moderate, I'm sorry about all that text. Don't struggle through reading it. This is a letter that, quote, 12 moderate, well, 12, quote, moderate members of Congress, that would be the House of Representatives, sent saying, oh my goodness gracious, we really are worried about these cuts to Medicaid. But really what this letter said was, we want to cut Medicaid expansion, but we want to get in front of that and by saying that we care about the vulnerable, do you see vulnerable populations in Pennsylvania? So let me just see if I can grab my pen that will highlight if I can. Okay, I guess I can. Okay, so if you look down in the second paragraph, bottom of the second paragraph, it says we don't want any reduction in Medicaid coverage for vulnerable populations. They're purposely using those words so that you understand that people who have Medicaid who use Medicaid expansion are not vulnerable. They are by their definition, able-bodied, and we want those people to not have access to Medicaid. But we want credit for standing up for our quote-unquote vulnerable populations. We're going to talk about the fallacy that's built into that in a minute. And so they do it again. Support rural and underserved communities, help new mothers, low-income working class families. They're trying to get ahead of making cuts to Medicaid expansion by identifying Medicaid expansion people as not deserving, but everybody else as deserving. I had to hit my sibling because that's where we are here. And it's offensive that they would even think that we would fall for this. Unfortunately, we are falling for it. People in America are falling for this line of thinking. They often do knee jerk, they react in a knee jerk way to this work equals value. I pay for my insurance. Why don't they pay for their insurance? So this kind of thing does work with, unfortunately, too many Americans. So that's what this letter was about. And I feature it here so you can see where we are now in their process. And one of our members of Congress, Bresnahan, from up north, Scranton, Pike County, Carbon County, I think, up there, he signed on to this letter. And then this is just more of that. What counts as a Medicaid cut? I'm going to skip that. So here we are. This is why I had to hit my sibling. Young men are playing video games all day long instead of getting jobs. You see that they're starting to, I would say soften the ground, but the ground has been softened over decades of demonizing people who I don't even know how to describe the people we're demonizing here. In this case, in a real switch for the Republican Party, they're demonizing young men, which, used to be their bread and butter, but now they're saying that it's these lazy young men playing video games all day instead of getting jobs. They're mooching off the government. That's who Medicaid expansion is. Of course, nothing could be further from the truth. Most Medicaid expansion people work. And, when you can't find a job, then you can't find a job. I think it would be really hard to tell someone in Greene County, Pennsylvania, who's I don't know, 58 years old and just lost their job, like I said, as in an accounting firm or something, that now they have to run out and get work. Why can't you get work? Well, who's hiring people who are, getting on the older side when they don't have to? And of course, with the coming recession, that's something else to think about, and how much harder it's going to be to have work. So, but like I said, this is Johnson, the Speaker of the House, trying to demonize people, trying to other people, trying to and ignite that feeling that Americans have: work equals value. You'll see that phrase, dignity of work. Yeah. Um, and here now, it's coming out more and more and more. Remember, I said they're writing the budget now? So now they have to actually tell us. Whereas before, they were not going to do anything to cut Medicaid. Now they're saying, oh, yeah, but we are going to end basically Medicaid expansion. The federal government, to get states to do Medicaid expansion, said we're going to pay 90% of what Medicaid expansion costs you. That's a huge match. Traditional Medicaid only gets matched at around, it depends on the state, low 50s for Pennsylvania, low 70s, I think, for Alabama. So states get help from the federal government to pay for their Medicaid. That's why it's a state federal partnership. They said, hey, for Medicaid expansion, the first couple of years was 100%. Then it dropped down to 90%, and that's where it's supposed to stay. They want to drop that match. And as soon as you drop that match, states are not going to be able to afford it. And that's where the ending Medicaid expansion comes in. They're going to tell you, we're not ending Medicaid expansion. I'm offended that you would suggest that we're ending Medicaid expansion. You're defaming us. Their favorite go-tos, right? We are wrong for pointing out the facts. If you drop that, a lot of states have trigger laws that as soon as this match goes below 90% Medicaid expansion, they're out of it. They opt out of it. That's a trigger law. A lot of states have that. Other states simply will not be able to afford it, especially if it drops all the way down to what traditional Medicaid, which in Pennsylvania is like low 50s. We would have that's where the $1 to $2 billion hole in the government, in the budget, comes every year from this, the loss of this money. Okay. And then the way they phrase it is particularly egregious. We have an expansion population that gets 90% federal money, and you have traditional Medicaid. So a disabled child in Kentucky, I mean, that should just make your stomach churn right there. They're using a disabled child as a prop in Kentucky. Gets 72 cents when they go to the doctor. And we know that's unsustainable. We want to fix it so everybody gets coverage. So I don't even know what this guy's talking about. Is 72 cents unsustainable? Does he want to lower that number? Or is he just pitting the Medicaid expansion population against the disabled child, which is, just a horrible thing to do. But that's their strategy. Their strategy, remember our picture back, I should have had that slide repeated, but remember that picture up above where we had everybody connected. They're saying, let's just take out the quote unquote able-bodied people. We're mad at them. They sit around playing video games all day. And 90% match for that. That's outrageous. When the poor disabled child only gets, remember, a child never gets anything. They simply are allowed to see a doctor. The state of Kentucky gets 72 cents on the dollar of that child's care. The child only gets 72 cents, and this is just fundamentally wrong. Unfortunately, this logic does resonate with people when it's not explained to them, and even sometimes when it is explained to them and they still don't understand. So, but this is how they're going. This is how they're explaining their position, and it's all just smoke and mirrors and flat out lies. Medicaid expansion numbers in these years. I just want you to see this for a quick second. So I saw these numbers and I said to my I think it was my government affairs person at PHAN. I said, "Gee, Aaron, why 1.2 million in 2022, 1.2 million in 2023?" And then it dropped. Like, why would it drop, Aaron? I don't understand why the number. And then the current number is 750. I don't get why that would happen. And, once people are on it and they're using it, we've found the people who need it. We've got them enrolled. This is great. She said, "Robin, you're forgetting about COVID." I said, "I 100% am forgetting about COVID. COVID was a national emergency. It was an economic emergency. It was a health emergency. People were losing their jobs, losing their access to coverage rather, and then care. And so the numbers covered by Medicaid expansion swelled, just as a safety net is supposed to work. So why did it go all the way until 2024? That's because as long as there was the COVID emergency in place, people on Medicaid expansion did not have to leave Medicaid expansion, even if they earned out of it. But most people who earned out of it had insurance from another job, and so they left Medicaid, will, by their own self. Other people did not get insurance with their new jobs, but they earned too much for Medicaid to qualify for Medicaid expansion, but they stayed on it because the COVID emergency was happening. And why would you take yourself off of insurance? So they stayed on it. Then the great unwinding happened, and they went around to everybody and they said, hey, you're on Medicaid expansion, but it looks like now you earn too much for to be qualified for Medicaid expansion, so you have to go off the program. And they did. Also, during that program, during that period of unwinding, they estimate that 50% of people who were removed from Medicaid were removed wrongly. And that's inevitable when it comes to administrative stuff. There's always mistakes to be made. And they estimate 50% of people who were kicked off of Medicaid during the unwinding should still be on Medicaid, but mistakes were made in the process. And the current number we're down to is around 750. But on the horizon, we have a recession coming. This is not me talking. This is every investment bank that makes forecasts is saying the same thing. We started the year at 20% chance of recession. Now some banks are saying there's a 70% chance of recession. When a recession happens, people lose their jobs. When people lose their jobs, they lose their health insurance. We cannot lose Medicaid expansion. We need to have Medicaid expansion. This is the timeline. They want their bill. When they say their mega bill passed, they mean through the House, through the Senate, to the White House. That's what they want. They're tying in the debt limit in all of this process, which I don't think we want to get into right now. But I will tell you that when you start pushing the debt limit into this whole process, that's like, I got to think of an image that isn't violent. Ugh. It makes it hypercritical that the budget gets passed because the debt cannot, we cannot have that debt limit not be renewed. We can't default on our obligations. That would be catastrophic for the country's world standing, which is already teetering. So they want to push the debt limit in there so that Democrats feel forced to go along and vote for this because, oh my gosh, if you don't, what's going to happen? The country will default. So it's really a you know what to the head here. Do you know the image I'm looking for here? That's what it is. That's what the debt limit it does when you add it into this. So that's bad. We need people to stand up and say, go ahead and default. Go ahead and default. Do it. We don't care anymore. You're nuts. Your plans have been insane. You want to take healthcare away from millions, literally millions of people, 20 million people nationwide if you get rid of Medicaid expansion. So you know what? This is your problem to deal with. But will the Democrats be strong enough to do that? Who knows? Okay. They want to have all this passed by July 4th. Why is that significant? It's because they have to do it fast because people cannot find out that they want to cut Medicaid. Right now, people still believe that the president said they will not cut Medicaid. And if you go out and you talk to people on the street and you poll them, they will tell you, oh, no, no, no. There are no cuts to Medicaid. I heard the president say it over and over and over again. He cherishes it. He uses the word cherish. He cherishes Medicaid. There are no cuts to Medicaid. People still believe it. And so they want to get this process through as quickly as possible. Getting a budget passed by July 4th would be fast. Usually it drags all the way out till the very last minute, September 30th. Sometimes you get a short continuing resolution and it drags out until October, November, even December. So that's standard budget stuff, procedure nowadays. So to get one passed July 4th would be a remarkably fast process. In fact, they had said the end of July, and then I think the president came out, or Besant came out and said, no, 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 July 4th, we want to do it on 4th of July. It's symbolic and it's a Liberation Day and all that nonsense. So, but that's bad for us because we're thinking, do you really think you can get it done that fast? That leaves us less time to expose what this budget is. Here's some good news, but not really good news, but it's some good news. They had wanted to get all the markup done on the House side, where they actually tell you now, where they actually show you, where the mom brings out the camera and says, "Hey, Billy, or I shouldn't gender it. Here, kid, here's where you said your sibling did this. There's no proof of that happening. Here, kid, we've got pictures of you actually striking your sibling. Now what are you going to do? All your lies have been exposed." When they get the markup done, all the lies will be exposed because they have to show us what they're going to do to Medicaid. That's what a budget is. They can't just be vague about it and say, oh, well, the next year we're going to not spend $880 billion. They can't do that. They have to show exactly where they're going to take that money away from people. And this is where they need to move very fast because they don't want people to, one, know about it, and two, react to it. So they wanted to get it done in the House, the markup, not the final vote, but the markup of the bill, of the budget. They wanted to get that done by May 9th was their target. Now they're saying, oh, we're going to have to put that off until the week of May 12th. So already they're having trouble. We don't know what that trouble is exactly, but we do know that they're not being able to move it as fast as they wanted to. This is not the great news it might look like. It's simply not bad news. So who relies on Pennsylvania? We know who relies on Pennsylvania. People in nursing homes, people in schools, adults aged 19 to 64, people giving birth and their newborns, disabled people. This is who relies on Medicaid. This is important, and I know charts are annoying, and believe me, I apologize, but this is an important one. And I think it's easy to understand, especially because we talked about that in the very, very beginning. Who's covered by Medicaid and what is the spend? So on the left side, you see you've got seniors and people with disabilities. They're 29% of the enrollment and 77% of the spend. Then you've got your kids, that big dark blue block, and then you've got adults. That's basically your Medicaid expansion. Basically, your Medicaid expansion piece of the puzzle. Okay. And you'll see if you just go to the right, that beautiful federal blue, that's Medicaid expansion. I just love that color. That color, that block, is a small part of the spend. The kids, the dark blue, are a small part of the spend. Why am I going over this again? You guys understood it the first time I did it. And I wish I could get I can't annotate for some reason. I don't know why. I can't find a pen to write with. But if I could, I would be circling those top two bars on the right and to make the point that you cannot get the cuts to Medicaid you want to get only by hurting Medicaid expansion adults and children, even children. And they're telling us they're only going to hurt Medicaid expansion people, that federal blue color. You see, it's not enough. They have to, by definition, the math has to math. They have to dig into the children. They have to dig into the seniors and people with disabilities. It's unavoidable. And one way they're going to do that is by instituting Medicaid work requirements, which remember have nothing to do with work, only have to do with putting another layer of red tape, another layer of paperwork on an already overburdened population when it comes to paperwork and red tape. And if you make a mistake, or if your application gets lost in the mail, or if the person on the administrative side keys in the wrong number, if you have the name Ann Smith, ANNE Smith, and another person is ANN Smith, and one of you is on Medicaid and the other one isn't, and look, they're looking at the wrong income numbers. ANNE Smith on a Medicaid gets taken off Medicaid. And for a long time, or a while anyway, she's not even going to know why. She's just going to show up at the pharmacy. She's going to say, I need my antipsychotic medications. I need my insulin. I need my inhaler. And the pharmacy is going to say, your card has been declined. Medicaid is not working for you right now. Give me 300, 700, whatever it costs dollars if you want the medicines that keep you from falling into a diabetic coma at night, or being able to keep you breathing when you have an asthma attack, or keep your your different mental illnesses in check, under control. That's what happens. That's the reality of losing care. It's this very abrupt thing that happens to people, and then they're left scrambling about what to do. Very few people have $700 on hand to buy medicines that are basically life-sustaining. So that's what Medicaid work requirements do. That's what that policy does. And you can see by this graph that there's no way they can make the cuts they need to make. And when I say need to make, if this were a call and response, if I had you in front of me in a classroom, I would say, why do they need to make these cuts? They need to make these cuts to pay for tax cuts for billionaires. They need to find about $5 trillion to give money to billionaires. That's why they're doing it. Medicaid is not in trouble we had 4 years of Joe Biden. I'm not saying he was perfect. I'm not defending him. I'm not saying anything good about Joe Biden in this sentence. What I'm saying is we had 4 years of Joe Biden and nobody talked about cutting Medicaid. The country was chugging along, the economy was doing pretty good, and nobody was talking about the need to cut Medicaid. So remember when they say the need to cut Medicaid, what is unsustainable is that they want to put $5 trillion in the hands of billionaires. And then this is our chart again. So Medicaid defenders, very quickly, I've talked for so long and I apologize, but there's so much going on. Medicaid defenders is what we're doing. We are a lot of people are doing things all over the country. Um, what we're doing is focusing on getting people, the people who don't usually reach out. We need them to make one call. And you might say, well, why one call? Why not make them make a call every day? Why not make them stand outside with signs? Why not make them write letters? Why not? Why not? Why not? Because they won't do it. They won't do it. So we can ask them to do all these things, but basically they're going to say, look, I'm busy. My life is busy. I care more about the environment. I care more about education, blah, blah, whatever. If we ask them to do one thing, make one call to your member of Congress between now and whenever this is over, and I will let you know when that time is. You're not going to do it as soon as you sign up. I will send out an email and let you know when to make that call. We think they'll be more likely to do it. And unfortunately, we have found that people are eager to sign up. The follow through on making the calls has not been 100%, which we expected. It's been pretty good though. And what the unfortunate part is we're running out of people to sign up. So we need more people to sign up to say that they will make this one call. Wait, get an email from, it's going to come from me, get an email from this Robin person at PHAN, and then in that week, you will make your call. If you're a person who calls every day, fine, that there's room for you, but you'd be better served as far as PHAN is concerned, finding 3 people to sign up for the Medicaid Defenders Campaign because you call every day. You're the person who calls every day. You're Joe. Who called today, secretary person at my office? Well, we had people call every day, and then, oh God, Joe, the Indivisible crew. The Indivisible crew called too. Oh, really? Okay, great. Whatever. They call every day. Now, I'm not saying there isn't value in calling every day. I think it's a noble pursuit and people should do it. I'm just telling you that it's not the whole, it cannot be the whole picture. Because what happened, what I just described is what happens. They bucket those people over in the they call every day. And so we need people who have not called before. Now they're getting nervous. Now they're saying, why am I hearing from all these new people? Why are people who've never called my office calling? Now I'm worried. Now I'm worried that Medicaid is something people care about, not just what the people who call every day care about. They care about everything all the time. Now I'm getting worried that this is spreading, and I have to really think about my vote. Can I really vote to end Medicaid if my constituents care about it? And that's the philosophy behind the Medicaid Defender Campaign. This just tells how we're doing. I think we have like 600 people signed up. I really think it's closer now to 700 easily. It could even be into the 800s number. Haven't counted. I just do the work, but I know I have like 9 groups of almost 100 each. So I'm thinking we're into the 800s of people who've said they'll do it. We don't have 100% follow through, which is a problem. So I'm working on making them make sure they make calls. And we definitely, even though that sounds like a big number, we need a lot more people to sign up, especially in our target districts, which I did not make a slide for. But I can just tell you now, you don't have to memorize it. I'll send it in a follow-up email. It would be Bucks County, that's Fitzpatrick. It would be Houlihan in the 6th, that would be Chester and Berks. Um, Bresnahan up north, that's Carbon, Pike, and Monroe, I believe. And the guy in Allentown, the Lehigh Valley, that's Mackenzie. That would be Northampton, Lehigh County. If I tell you Lehigh Valley, it's that area. And also he's got some Carbon now. So those are the parts of the state where we really, 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 really need people to sign up. But we want people in every part of the state because we're making calls to every single member of the House. And that's what we're doing. And I'm sorry it took so long to go through all of it. But if you have any questions, I will send all this follow-up material, like how you sign up, to Clara. Hopefully she'll share it with all your network. People will sign up, and then, we'll have more people making calls.
So
I,
can
I
we
can stop
open
sharing.
it up for questions?
Yeah. Oh, I'm not going to do that today. This is Soapbox. I'll just tell you, this is our really cool story sharing. You can let Clara know. Or you can let me know if you have people who want to tell stories. I can hook them up with this amazing video platform where they can tell their story if they'd like to about Medicaid. And that's my contact information.
So, Robin, my question is, this is Bill Clinton, and my question is, why is it just focused on the House and not the House and Senate?
Hmm. The margin in the Senate is really huge. Remember, there's no filibuster, and it's 53 to 47, I believe, in the Senate.
Right?
And where are they going to find? They're going to have to find four, 53, right? So they're going to have to find four because 50-50, the vice president can break the tie. And so that's a lot. The Senate is a lot. And also, it's happening now more in the House than in the Senate. Also, we're a Pennsylvania operation, and so McCormick is probably not movable.
Right.
Although when
Okay.
it moves to the Senate, don't worry, we will be talking about the Senate. We're not giving up. And then Fetterman has made noise like he is a good vote on this, but I don't know if you're aware of Fetterman's recent the
Right. I am aware of that.
so
The
now
other,
that throws a monkey wrench into it too. So
right. So I am in Delaware County, where we're fortunate to have a lot of Democrats representing us. And should the focus be to them or to the 4 or 5 people that you've identified as targets for this initiative?
as a constituent, you really only have power with your elected. So I guess in Delaware County, it's probably Scanlon.
Yes.
Okay. So you only have power with Scanlon, but that does, and Scanlon's a reliable vote. We think Scanlon's reliable. Now, two things on that. One, we're not taking anyone's vote for granted, especially on work requirements, where they might view that as a reasonable compromise, blah, blah, blah. So we definitely want everybody to hear about work requirements. And that's part of our messaging now. When you're told to call, when you're notified that this is your week to call, it does mention, like, please mention work requirements, please mention Medicaid expansion. But why else do we want people like Scanlon to hear the good news? It's because she then goes to Washington, talks to people, and
Right.
says what she's hearing. I don't know. I'm hearing a lot about this Medicaid, a lot about Medicaid expansion. This is not a Target gotcha campaign. They are talking to Democrats too about it. This is not anti-Republican. This is really pro-Medicaid. I
Right.
should let you know at this point that we just completed a storybook, and we have stories from every district except Erie, the Erie region, which I think that's 16. Doesn't matter. We did not, and we weren't able to get a story from there, but we did put together a printed storybook with multiple stories from every single district. So Scanlon, for instance, can walk around Washington with this storybook and say, look, people, look,
Right.
I have these people in my district. They're all over Pennsylvania. You have them too in Colorado, wherever. Mississippi, Alabama, and Montana. You have them. This is not unique to Pennsylvania. Let me share with you my storybook and you can see. So we're working on everybody, not just a few.
And then Clara, I understand that you have this information that you could send out. And my question is to whom? Are you sending it out to 5 people on the call, or is there another strategy?
Um, No, typically the way it works, Bill, is that after we have an action hour, it is put up onto
Oh,
our
yeah.
website in a recap document. And then a blast is sent out to our over 1,500 supporters,
Got it.
including the 12 that are currently on the call. And they get the recap document and then they can take the action.
Got it. Thank you.
And Clara doesn't have the information yet, but she will today. Right. And I try to keep it as simple as possible. Here's how to sign up. Here's how to tell your story. Click, click, like that.
Oh, quick question. I am new to the group. Do I need to send you an email to actively opt in or just passively for everybody who's on the call?
I don't know who asked that question.
Kathy.
Kathy? Kathy, do you receive our regular e-blast from UUJusticePA?
I don't remember.
Okay, so I'm going to send you my email address and I just ask
Okay.
that you email me and I'll make sure that you get the information.
Perfect. Thank you so much. Appreciate your help.
Any questions? I know I covered a ton and went really fast. We are in a dire situation. We are not giving up. I should let you know that in 2017, we faced a very similar situation when John McCain had his famous thumbs down moment. Everybody remembers that as saving the ACA, which it did, but it also prevented
I told my dad I got me back.
block grants from going into place on around Medicaid. So Medicaid was very close to having very bad things happen to it in 2017, and it didn't. We have not given up now. A miracle could happen, and we could have some senators band together and have their own McCain moment. That could happen. It's unlikely, but that doesn't mean it doesn't happen. So we have to keep the pressure on. And all that to say, we have to just keep the pressure on and actually escalate the pressure.
And I think for all of us on this call, once the information is passed on to you, these are great relational conversations to have in your congregation with members of your congregation and hopefully get them to sign on as defenders as well.
Happy to talk to an individual congregation. We can make the tone anything you want. I will warn you that the word Republican has to be said because it is, that's a fact. That's the party in charge, and that's who's moving it. That's not judgment, that's a fact. Um, and the things they are doing are very bad, which is also an objective fact. Skirting around the parliamentarian is a bad thing to do. Uh, you know, Violating a norm is not a good idea unless the norm is objectively awful. And, having the parliamentarian review your legislation is something that harms no one and actually, you know, helps the process. So to skirt that is something that is not good. And
Well,
of course, cutting Medicaid also not good.
this has been such a powerful action hour, and I want to thank you so much for joining us. I know you're doing a lot right now personally, so we really appreciate your time.
Oh,
Once
sure.
you send me the information, I will make sure that it is passed along to all of our supporters. And again, thank you very much for joining us.
Thank you for letting me be here. It means a lot to be able to talk to people, small group, a big group, whatever, talking to people because, it spreads, and that's what we need. I'm available to anybody who wants to talk to me. I'm going to give you a link, Clara, that they click on the link, they sign up, they pick a time where they want to talk to me. So if anybody on this call, if a congregation in York County says, I want to talk to you before you talk to us, or I just want to talk to you, then you just make an appointment, and I'm happy to talk to anybody.
Perfect. Thank you. Should I also include that in the action hour recap?
Yes, I
Okay,
think the link to see, yeah, because they might be like, and I want to hear from this person again. I don't understand what she's saying. I don't understand what you're talking about. I want to talk to her, tell her our situation and see what fits. Happy to do that as
perfect.
soon as possible because you saw the timeline, right? July. So we just want to roll as fast as we can.
Perfect. Well, we don't want to take any more of your time. We have reached that hour.
Sorry.
Thank you.
Okay.
No, 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 no. We want to be respectful of your time. Thank you so much, Robin. And we're going to get busy, get activated.
Thank you. Good luck to everybody. Thanks for being here.
Bye.
Bye bye.